Well, good morning, members of Labor and Health Committee, and those that have joined us in the audience, Mr. Caldwell with LSO, and those of us that have joined us via Zoom. Mr. Caldwell, if you would call the roll.
Representative Clouston.
Here.
Representative Guggenmoss.
Here.
Representative Heft. Representative McCann. Representative Ottman.
Here.
Representative Stivar.
Excused.
Representative Wasserberger. Representative Yen.
Here.
Chairman Rodriguez Williams. We have a quorum.
Thank you. So again, welcome to our visitors here with us today in person. I'm going to briefly read over a few expectations of the committee when it comes to decorum. If you need a paper copy of these rules, they're located outside of the meeting room. We will deal with two bills today on the table. I would ask that you please keep your cell phones on silent. Although it may seem awkward formality, speakers will address their comments and questions to the chairman, not to individual committee members or to others in attendance. This helps us avoid personalities and comments of a personal nature. Comments will be directed to the issue under discussion by the committee. Distracting comments or on unrelated or side issues are out of order, and I will call them out of order. Speakers will avoid personal criticism, ridicule, or name-calling directed at anyone else in attendance at the meeting. This includes comments of a personal nature directed at other speakers, audience members, or members of the committee. For audience members, we expect you will refrain from any behavior that disrupts the orderly conduct of the meeting. Specifically, our rules prohibit speaking out when another person is talking, carrying on loud and distracting side conversations, any shouting, clapping, wooing, or boos in response to any speaker's comments. Our general guideline is simply that everyone conducts themselves in a civil and respectful manner at all times during the meeting. With that in mind, we are going to consider House Bill 96, titled Prohibiting Mask, Vaccine, and Testing Discrimination. First, I will place House Bill 96 on the table for consideration and ask the bill sponsor, who is Representative McCann, please to take a chair. And Representative McCann, it's my understanding you have a guest to help you present this bill as well. Thank you for that. And you can bring. Yeah, welcome former Representative Ward.
Okay, my name's Darren McCann, House Representative for House District 48. Just a little background on myself. I've been a PA since 2001, primarily in orthopedics. And probably more important to this bill, prior to that, I was a special forces medic. So I do have some expertise in infectious disease and parasitic medicine because we end up doing a lot of work down in third world countries, as well as scientific study and critical thinking. So that's kind of my background as far as being able to decipher through this bill. And with that, just like to go through the bill real quick.
Yes, please do so.
All right, so the first page, mainly just who, what, when, and where, what we're discussing, mainly to prohibit discrimination against people who decide they don't want to wear a mask or be vaccinated, okay? Page 2 and part of 3, mainly just the definitions for COVID-19 is primarily what this is geared at, as well as the face masks and also vaccines. The bottom 2/3 of page 3 is what we're asking to do as far as people not being discriminated against or held in contempt, if you will, for deciding that they don't want to wear a mask or get vaccinated or tested for that matter. And that pretty much sums it up. Pretty quick, Bill. Any comments, ma'am?
Former Representative Ward.
Thank you, Madam Chairwoman. Just some thoughts I'd like to add. A possible amendment would be to make this apply not only to COVID-19 and all its variants, but to any disease status. You could remove COVID-19 from the sections that describe what can't be discriminated against. That's just a thought. This particular bill does apply to any person, and the person means governmental agency, any person, anywhere. Person is a person who receives government subsidy. One of the arguments previously presented was that you can't tell private businesses what to do. So that's why item B under 5B said no person who receives subsidies from the state or federal government shall. So this applies to anyone who receives taxpayer funds of any sort. So that kind of eliminates that argument that it's private business. By way of further explanation, this bill eliminates discrimination for not wearing a mask, not receiving a so-called vaccine, or not getting tested. The bill protects individual liberty by requiring that all persons, i.e. businesses and organizations, public and private, who receive any kind of taxpayer subsidy, not discriminate against those who refuse to wear a mask, receive a vaccine, or get tested. A few summers ago, one of my daughters needed a sports physical in Casper. We needed it quickly, so we stopped at the community health center. We were turned away at the door because we refused to wear a mask. I couldn't believe this was still a thing in 2022 in Wyoming. Then this year, my daughter, who was in the nursing program at college, was required to get a COVID test to continue her nursing program. In 2024 in Wyoming, how is this still a thing? My daughter has since left the nursing program. To those lobbyists and agencies who have come before this committee to bemoan the fact that they can't get healthcare workers, this is why. The healthcare cartel has done more to destroy the trust of the American people than any other sector. The bill prioritizes the rights of the individual, of we the people. Tyranny by big business is one and the same as tyranny by big government. We the people are taking back our liberties. Government exists to protect, first and foremost, individual liberty. Private businesses, especially those receiving taxpayer money, do not own their customers or their employees. They don't have free rein to abuse us. We're not their slaves. Requiring masks, vaccines, and testing to get work, get an education, or be seen by a doctor is a form of discrimination that should be illegal.
Thank you, former Representative Ward. Any further from either of you on describing this bill before the committee?
I'm open for questions at this point, Madam Chair. Thank you.
Thank you. Any questions from the committee for Representative McCann? Representative Klauston.
Thank you, Madam Chair. Thank you both for being here today. This is something we've dealt with in the past. So I'll just bring up some points and questions that I've had in the past. First of all, to either one of you, how would this apply to situations in the ICU, in surgery, in somebody with infectious disease? So you're in surgery, orthopedic surgery, we have a sterile field, somebody doesn't want to wear a mask as in employment. How does that apply to that situation? How do we still protect that patient?
Madam Chair,
Representative McCann.
sorry. Madam Chair, that's come up, had some good discussions with some lobbyists for the Hospital Association. We're obviously probably going to have some sort of exemption in the medical arena as far as that goes. I've also had some pushback from the industrial side as far as like the industrial dust along those lines. So I fully expect some amendments to come along for that. And
Follow-up, Representative Klauston.
Ms. Ward would like to comment, please.
Ms. Ward.
Thank you, Madam Chairwoman. This bill applies only as written to COVID-19, so it wouldn't apply to PPE required for industrial hygiene or in the operating room. It's not intended to cover that. As it's written, if you leave it applicable to COVID-19, those PPE in industrial settings and PPE in operating rooms are not the same as COVID-19 type PPE. So it wouldn't apply. But you could add an amendment that explicitly says that.
Representative Clauston, follow up.
Thank you, Madam Chair. Again, to both of you. Person, Wyoming Statute 81102, A6. Wyoming Statute, person includes individuals, partnerships, corporations, joint stock companies, associations, and any other public or private entity. So just want to be clear on this bill. When we say person, was your intent to be a human being only? But we have to consider that this will basically include everywhere in Wyoming. So just asking what your intent of the word person in the statute.
Thank you. Either Representative McCann or former Representative Ward.
Thank you, Madam Chair. I'll let Ms. Ward handle that, please.
Thank you, Madam Chairwoman. It is intended that person refers to, as you just described, everyone, including public and private entities. So yes, all of Wyoming.
Representative Clauston.
Thank you, Madam Chair. After dealing with this for a couple years, So one of the things that's come up in the past that we need to address and make everybody aware of is, and maybe some of the other speakers can address this, but by doing this, we may put our ability to receive federal funds in jeopardy. That's been brought up in the past. I looked it up. In 2023, Wyoming received just short of $2 billion in Medicaid funds from the federal government. So, and that's not including Medicaid or VA or TRICARE. So just want to make it clear and want your opinion on what are the chances of losing that $2 billion just concerning Medicaid or Medicare? If we did, what effect would that have on our state budget and our state hospitals?
Representative McCann.
Ms. Ward, handle that, please. Thank you.
Former Representative Ward.
Thank you, Madam Chairwoman. So given the current administration that is going to be inaugurated today, I don't anticipate that will be a problem. That's the first thing. And secondly, I don't anticipate that they will enforce that. I don't think that they will withhold the federal funds. And if they do, we need to, as a state, get off federal funds. But I don't think it will be a problem.
Any additional comments of the committee? Representative Wasserberger.
Thank you, Madam Chair. Just a quick question. I remember a few years ago, there were some of the nurses that chose not to get vaccinated, and they were required to wear pins saying that they weren't vaccinated and wearing masks as well. Would this apply to them so they could have their privacy if they choose not to be?
Representative McCann.
Thank you, Madam Chair. Yes.
Further questions from the committee or the bill sponsors? Seeing none, thank you very much both for presenting the bill. Stick around in case there's questions. Please raise your hand if you plan on testifying on House Bill 96 if you're in the audience. We got 1, 2, 3 hands up. Okay, we've got about 3 on Zoom. So I'm going to just ask that you keep your time limited to, I think we'll do 4 minutes per person because we do have another bill that has several, lots of public testimony. So if there's any government agencies, please come forward. Welcome, Director. Good morning. You just state your name and your stance on this bill.
Good morning, Madam Chairman, members of the committee. Stefan Johansson with the Wyoming Department of Health. I'll keep my comments very brief. That was a helpful discussion from the sponsor and former Representative Ward. Really just here to answer any questions that the committee might have for the Health Department.
Thank you, Director. Any questions for the Director of Department of Health from our committee? Representative Ottman.
Good morning, Director. Oh, Madam Chairman. Good morning, Director. Can you give me the reason why this is still, even though the federal mandate has been taken away that I know of, why this is still an issue in nursing homes, hospital settings, and things like that?
Director Johansson.
Madam Chairman, thank you. Representative Ottman. So the situation has changed, obviously, over the past couple of years since the height of the pandemic, and especially the public health emergency on the federal level, which did result in some regulatory changes from the Centers for Medicare and Medicaid Services, or CMS, primarily for some of the healthcare providers that you mentioned that treat Medicare, Medicaid patients and receive Medicare and Medicaid funds. Nursing homes are a good example because while those regulatory requirements are fluid, they are still every nursing home that is certified with the federal government, with CMS, has to comply with certain infection control requirements. The reason I say they're fluid is it really evolves and it's kind of geographic and facility specific. So for example, if there is a significant prevalence or outbreak of COVID-19 in a nursing home facility, even today, the nursing facility is expected to take certain actions, both preventive and reactive. For example, if there's heightened levels, you have several staff and patients that have been diagnosed or come down with COVID-19, then there would be an expectation that the facility take certain precautions. One of those could be requiring or encouraging staff masking, resident masking in public areas, as well as other measures like physical distancing, the dining hall, for example. It really does depend on the situation, but that, in terms of healthcare facilities and CMS as it pertains to COVID-19 requirements right now, nursing facilities are really one of the only examples where that is still in play, so to speak. And again, it happens where the facility, regardless of the federal government, is likely going to react, try preventive measures or reactive measures when there's an outbreak of COVID, when there's an outbreak of flu, when there's any infectious disease, to try to protect the elderly and vulnerable residents they have. If I can phrase it this way, it's probably not the best term, but the punitive measures really come on the back end. So the federal government comes in either regularly or on a complaint investigation and surveys various conditions of participation. This could be one of them, depending on the situation in that particular facility, where those actions would be looked at. Did the facility, did the leadership take the appropriate precautions to protect the residents that they have? And this is one of them for nursing homes. The requirements that we saw from the federal government as it pertains to vaccination status or exemptions, that has since gone away. That is no longer in enforcement right now. So Representative Ottman, it's probably not a great answer to your question because it is very situation dependent, very facility dependent on COVID-19 right now and what the facility might be seeing in terms of infection rates.
Thank you, Director. Any further questions? Representative Klauston.
Thank you, Madam Chair. Thank you, Director. So I was just in North Dakota visiting my dad, who is in a nursing home. There was a COVID-19 outbreak, so everyone was required to wear masks to protect the residents. If we pass this into law, how would that affect those nursing homes? And then how would CMS look at it if our nursing homes aren't following their guidelines?
Director.
Madam Chairman, Representative Klauston, it's hard to answer. Again, it really depends on that facility's policies. In a hypothetical, there could be a situation where there's a lot of COVID-19 running through a facility. And I want to be very clear here that what we know, and certainly what we knew later on in the pandemic, is who is more likely to suffer severe disease from being infected with COVID-19. And that really was elderly, immunocompromised patients, et cetera. And so nursing homes are one of the, I think, preeminent examples of where the risk is for any infectious or communicable disease, just given the setting and given the vulnerability of the patients. In that hypothetical, Representative Klauston, and again, I don't want to sound alarmist here that the sky falls, but there could be a situation where under this bill, If a facility did not require staff or even residents in common areas to take precautions, there could be, emphasis on could be a situation where federal government surveys the facility, determines from the federal regulatory perspective that enough action was not taken. And there would likely be a conflict where the facility, rightfully so, would say, I'm following state law here. I can't discriminate against my staff and require that masking, where the federal government is issuing a citation, potentially a penalty, saying you didn't do enough to protect the residents. So just being honest here, members of the committee, it just creates a little bit of a potential conflict. And again, I think that could be sorted out in the legal system, but it certainly does create an awkward position for certain healthcare facilities to wrestle with which requirement would they adhere to. As we've discussed, and as I know former Representative Ward discussed over the past 2 years, there was a feeling before that, well, if you don't follow the federal regulatory requirements at that time, then you're immediately shut down or the federal funds are immediately lifted. That's not true. As we discussed on a previous bill last week, the survey process unfolds in a deliberate manner where there's a survey for all kinds of conditions of participation. Certain citations or tags might be issued, and a request for a corrective action plan is put into place. The facility works on that corrective action plan to avoid future penalties or citations. And so that is a months-long process. But again, Representative Clouston, my answer would be, it just creates that potential for a conflict between two different regulatory requirements.
Thank you, Director. Any additional comments or questions for the Director? Representative McCann.
Thank you, Madam Chair. Mainly just a point of knowledge. Most of the masks that we're talking about don't stop viruses. So I think that needs to be noted. I'm not here to bellyache or berate anything, but the majority of the masks that people use do not work against viruses. So maybe we need to define a mask. Thank you.
Thank you, Representative McCann. Thank you, Director, for joining us. Any other government agencies? Okay, seeing none, we will move on to public comment. Please come forward if you'd like to testify on House Bill 96. There's 3 chairs up here, so don't be shy, whether you're for or against the bill. Okay, all right, you're it. Former Representative Penn, good morning, welcome.
Good morning, Madam Chairman and committee. On this frigid morning, I got a message on my phone that says Cheyenne temperatures will be lower than normal today, and I would attest to that, but it's a privilege to be here before you this morning. I stand in support of this bill. 2 years ago, we sat, as Representative Clouston said, and deliberated this very same bill. We heard testimony from Wyoming nurses, from Wyoming teachers who lost their jobs, who were threatened with loss of livelihood. My own husband was threatened with that as a teacher because they wouldn't get the vaccination. We heard testimony from patients who were refused care in the emergency department because they wouldn't wear a mask. The emergency department is a place where you're not supposed to have care refused. It's not so fresh here 2 years later, but is it still pertinent? I would say, yes, it is. So what happened before? Was it well-meaning do-gooders that were just trying to do the right thing and protect people? Or was it a power-hungry agenda? We have the luxury of looking back for 4 to 5 years and ask the question, did we do the right thing? I think let's look at some statistics. VAERS, the Vaccine Adverse Event Reporting System. If you look at the reports of COVID-19 shots that were generated, they have generated over 3,000 studies because of the adverse events that have been reported on COVID-19 shots, 3,000 studies. Prior to the COVID-19 shot, no vaccination has generated over 50 studies. Cause for question. If you combine 30 years of VAERS death reports, there are 5,241. If you compare that with 1 year of the COVID shot reports of death, 9,778 in 1 year. Just in December of this last 2024, there was a study that was put out that showed that there is a negative efficacy of the COVID-19 shot. So what does that mean? That means that you have a higher incidence of getting COVID if you're vaxxed, and this was during the pandemic. And that risk increases with each shot that you get. A similar study put out by the Cleveland Clinic earlier this year, I think it was in about May or so, corroborated the same thing. Anywhere from 60% higher likelihood of getting COVID with 1 to 2 shots, up into one of the studies even showed a 253% increase with over 3 or more shots. We can have the discussion about masks. Representative McCann brought that up. I would say if you understand a little bit of physics and understand the fact that a chain link fence is not going to keep out a bee, then I think we can understand that masks do not work for viral infections. We're not talking about bacteria here, we're talking about viral infections. But really, this discussion is not about the effectiveness of this vaccine or masks. This is discussion about individual liberty. We witnessed tyranny, and I don't think we want to let it happen again. In a free society, we must stand up to protect liberty and step in when our rights are being crushed. Are we willing to vote against liberty because we're unwilling to cut ties with our federal dollars? So to answer my previous question, did we do the right thing? I would say no. We allow the federal government to push us around. And today we can say, we can push back on them and we can ensure that this is not going to happen again in Wyoming. Here in the land of the free, on a special day, inauguration day of our president, Wyoming may be America's last hope. So I would ask for your favorable consideration of this, and I would stand for any further questions.
Thank you, former Representative Penn. Any questions from the committee? Comments? Seeing none, thank you very much.
Thank you.
Any additional public comments? Come forward. Please state your name and who you're with and whether you're for or against the bill. And we are putting a 4-minute time limit on each testimony, so welcome.
Thank you, Madam Chair, members of the committee. My name is Steve Melia from Cheyenne, Wyoming here. My background is in public health. I worked with the Baton Rouge EMS, the City of Houston Health Department, and 20 years here with the Health Department in infectious diseases of various sorts. I would stand with former Representative Penn in everything that she has said, so I won't repeat it. I will say that masks at times will give people a false sense of security, that they really won't take other precautions, excuse me, and that I keep seeing people with masks on, and that's fine. Maybe they have a cold or whatever, but do they really think that's going to protect them against the viral infections? And a lot of the masks that people wear are really for bloodborne pathogens, for people in the emergency department or surgery, so that blood doesn't splash on them, or they're not going to, when they're speaking, have spittle come down on top of them. So I think that we need to do exactly what former Representative Penn has said, and others that have been commenting on this bill. So I appreciate your time.
Thank you, Mr. Melia. Any questions of Mr. Melia from the committee? Okay, thank you for your time. Seeing none, Senator Pearson, welcome to Labor and Health. Please state your name and whether you're for and against the bill.
Thank you, Chairman and members of the committee. My name is Laura Tolliver Pearson. I'm a newly elected senator in our legislature. So I am in favor of this bill. As many of you know, a lot of the reason that I am here is because of COVID. That was a wake-up call for me. I was following the VAERS data back during COVID. I felt like our legislators were not protecting us. And I felt like that our legislature was basically saying that the federal dollars were more important than our lives. And so I would ask you to please vote in favor of this bill. Thank you.
Thank you, Senator. Any questions of Senator Pearson from the committee? Seeing none. Okay, thank you for joining us. All right, Mr. Caldwell, we will move to public comment on Zoom. And if you can just tell me who you're letting in, that would be great. Ms. Carpenter, welcome to House Labor and Health. Please state your name and who you're representing, and we are excited to hear your testimony. We're limiting public comment to 4 minutes. Thank
All
you.
right. Thank you, Madam Chair, members of the committee. My name is Kelly Carpenter. I'm a Policy Advocacy Director for the Wyoming Farm Bureau Federation. Today, I would like to provide comment on behalf of our membership, and it is our membership's policy to support this legislation. We support eliminating discrimination based on vaccine or mask status, especially in reference to COVID-19. We aren't saying you can't wear a mask or can't get a vaccine, but our membership firmly believes in personal choice on vaccines, especially those that haven't gone through the typical decade-long FDA approval process. Again, our members support the choice in regard to these items and would like to ensure that people are not discriminated against for their vaccine or mask choices. Thank you again for the opportunity, and I'll take any questions you or the committee may have.
Thank you, Ms. Carpenter. Any questions from the committee for Ms. Carpenter? Representative Yin.
Thank you, Madam Chairman. Ms. Carpenter, can you just let me know where you are calling in from? Thank you.
Madam Chair, Representative Yin, I am calling in from Laramie.
Thank you. Any additional questions or comments of Ms. Carpenter from the committee? Vice Chair Ottman.
Thank you, Madam Chairman. Ms. Carpenter, can you give me just a brief synopsis of your, the people that you represent, the communities or the backgrounds of them? Thank you.
Ms. Carpenter.
Madam Chair, Representative Ottman, yes, thank you. I represent a wide swath of folks, primarily in the involved in the agricultural sector, but from every community, large and small, across the state.
Thank you, Ms. Carpenter. Any additional questions? Seeing none, thank you for joining us today.
Thank you.
We'll move on to the next public comment on Zoom.
Good morning, Madam Chairman. My name is.
Good morning, Mr. Brubaker.
Good morning. My name is Devin Brubaker. I am the airport director for the Southwest Wyoming Regional Airport in Rock Springs. I also am here to represent the Wyoming Airports Coalition. I apologize, I do not have my camera on. I just got out of a snowplow, so I am not properly dressed for this meeting. I apologize for that. I appreciate the opportunity to speak to you about this bill. The Wyoming Airports Coalition stands in opposition to this bill. As many of you are aware, Wyoming Airports, there's 40 public use airports in the state. Each year, they are funded with nearly $50 million of user fee-based grants from the Federal Aviation Administration. This bill would put us in conflict with federal grant assurances should there be another instance of COVID-19. During the most recent instance, airports were required as part of our federal grants to post signage in our terminals and our public facilities about requiring the use of masks. And furthermore, passengers were not allowed to access secure areas of the terminal where the federal government controls access through their security checkpoints. I can tell you, Madam Chair, that at my airport, I would trade $1 million grant for a $5,000 fine any day. Because that's what's good for my community. That's what's good for my airport. And so, Madam Chair, this bill puts us in severe conflict with potential future obligations from the federal government. And once again, those grants are user fee based. They are not funded from the general fund. They are funded based on user fees of the air transportation system in this country. So I would respectfully ask the committee to vote no on this bill today. Happy to answer any questions.
Thank you, Mr. Brubacher, for joining us and for your testimony. Committee, do you have any questions of Mr. Brubacher? One from the bill sponsor, Representative McCann.
Thank you, Madam Chair. Sir, I'm just wondering if you had any suggestions for that might make this better bill for you, but it still be able to go forward with it?
Madam Chair, Representative McCann, I appreciate the question. I believe there was some talk earlier about exemption for healthcare facilities. If there was an exemption for airports in the state of Wyoming within this bill, that would make this bill palatable to the airports.
Thank you, Mr. Brubacher. Any additional questions? Vice Chair Ottman.
Madam Chairman, Mr. Brubaker, thank you. Over the years, I've flown quite a bit, not as much in the last few years, but it was just a given that a lot of times when you flew, you were going to end up with a cold or whatever because of just the closeness and stuff. Why is it just because of the grant money that you're adamant about this, or were you concerned about protocols previously and cleaning of the equipment? Can you just explain that a little bit, please?
Mr. Brubacher.
Madam Chair, Representative Ottman, appreciate the question. Our chief concern with this legislation is the conflict that it would put airports in when it comes to being able to accept those user fee-based grants. I will say that without getting into the efficacy of aircraft filtration systems and all of those kinds of things, today's aircraft do have quite a bit of capability of supporting the filtration of air and the rapid turnover of air in the cabin to minimize the spread of disease and such. However, once again, our concern with this legislation is how it puts myself as a public entity and a public officer in conflict between federal and state law. And as I said earlier, if I have the choice of either I need to take $1 million grant to improve our airport and save $1 million for our local community, I would trade a $5,000 fine any day for that. But I don't think that's fair to our local taxpayers that they should have to pay a $5,000 fine for us to be able to accept $1 million grant.
Thank you, Mr. Brubacher. Any additional questions? Seeing Representative McCann.
Thank you, Madam Chair. What was his last name? Brubacher? Sir, Darren McCann again. What's your feeling on this new administration coming in? I mean, it might be a little bit early for you to make a decision or a comment on this, but do you think they're going to be a detriment to this type of legislation?
Mr. Brubaker.
Madam Chair, Representative McCann, I will not surmise on the efficacy of the incoming administration or past administrations. I will say that this is a 4-year administration with no guarantee that it continues beyond that. And I don't know how many years it's been that this bill's been before this legislature or something similar. I would be very concerned that even if it was not an issue during this administration, should there be a different administration in 4 years that has a different outlook in this area, how many more years would it take the legislature to remove this legislation out of statute or modify it so that airports are not put in that predicament?
Thank you. Okay. Mr. Brubaker, thank you again for joining us this morning.
Thank you, and appreciate your flexibility of not having my camera on today. I figured a hoodie was not appropriate. I've been in a plow since about 4 o'clock this morning, so thank you.
No problem. And it looks like we have one more on Zoom for
Madam
House Bill.
Chairman, there are several more attendees, but none of them have their hands raised. I believe they're here for the next bill.
Mr. Caldwell, I have one that says Shelta Ramber for, okay, perfect.
Hi, good morning. Oh,
Good morning, Ms. Ranburn. Please state your name and who you represent. And we're excited to hear your testimony. And we're limiting it to 4 minutes. So thank you for joining us.
yes, Madam Chairwoman. My name is Shelta Ramber. I reside in Sheridan County. I am representing my family. I'm speaking in favor of House Bill 96. Remember, trust the science. It was all a lie. Masks have been proven to not work. Some of the comments from other speakers, I just want to plead to you to not pick federal dollars over your citizens. I understand that money makes our state run, but so do the citizens, and they deserve the respect given to them and their tax dollars. I also, like Jeanette Ward had said, would like to see this not just exclusive to COVID related. I fear the future for my children, and I would like this to not be something that my children have to be discriminated against for the rest of their lives for ABC disease. In 2021, on the first day of school, myself, my then 8th grade daughter, and her friend were threatened to be arrested by the Sheridan Police Department on behalf of Sheridan County School District 2 for not wearing masks. I tried to assert our rights. The officer did not care. He said we were trespassing and that he was going to arrest all of us if we did not leave. Instead of making my daughter, who has really bad anxiety, go into a full-blown panic attack, I decided to leave the school building. The day before this event had transpired, I had communicated my right under Wyoming Statute 14-2-206, Federal Law Title 21, Section 360 BBB-3, Title 3, Sections 36.202 A, B, and C, and 36.203 A, B, and C, the Civil Rights Act of 1964, and that mandates are not laws. To the school board, to the superintendent, and to the principal, I gave them all notice in writing that if they violated these laws, I would pursue action. They ignored our rights and denied my daughter and her friend entry to their free appropriate public education, or afforded us due process. We were not the only ones across the state that this happened to. I know staff members who were let go because they refused to wear masks for health reasons. Grace Smith is still fighting to correct this terrible violation that happened to her. I have learned many lessons from COVID. A major one is that without a law like House Bill 96, Wyoming citizens' rights to make their own decisions about healthcare really do not exist. The sheriff had even said to me, without a penalty at the end of the statute, there is nothing for him to enforce. I felt helpless and very angry. House Bill 96 will solidify the rights of the citizens of Wyoming and keep those in power in check if they ever overstep their authority again. Please vote yes. Thank you.
Thank you, Ms. Ramber. Any questions from the committee? Okay, seeing none, thank you again for joining us this morning. And that concludes our Zoom public comment on House Bill 96. We will move on and take public comment from any registered lobbyists, so please come forward. Good morning, welcome. Please state your name and whether or not you support or oppose the bill and You two will be timed 4 minutes as well, so.
Madam Chairman, committee members, Eric Bully with the Wyoming Hospital Association, and I also represent the nursing homes in the state, Leading Age Wyoming. And we have some real concerns with this bill. And it's mainly on the long-term care side of things. I think Director Johansson did a good job of starting a very important conversation. But what I would share is that whether we believe the pandemic is over or not, requirements and regulations are still in place for COVID-19, especially when it comes to our long-term care facilities. We have 35 nursing homes in the state. We lost one last year. We have several that are considering closure right now. A lot of it has to do with staffing, but a lot of it has to do with the environment that we're operating under. I have fears that if this legislature passes in its current form, we'll lose more nursing homes. And our aging population, I think demographically, we're gonna be the second oldest, demographically, the second oldest state in the nation, quickly approaching the first. Director Johansson talked about the survey process. And I would tell you, I was on a call with the Department of Health. We have weekly calls with license and survey our nursing homes do each week. And there are 6 of our nursing homes right now that are in outbreak status, which means that there are more than 2 people that have COVID in those facilities. We do have a few COVID cases in our hospitals right now, not to the degree that we had years ago, but there are still hospitalizations. When it comes to long-term care, this bill is going to put us in a predicament. And it's the same one that we talked about last year, the year before, and during COVID. Federal law requires us to do certain things, and one is to mask when we have outbreaks in our facilities. I would push back a little bit. N95 masks that are fitted are effective against viral infections as well. Most of our staff are required to wear N95s, not the regular surgical masks or the cloth masks that you see. If we pass this bill, you're putting us in the same situation that the airports just talked about. We would have conflicting laws and conflicting rules. And whether we like it or not, our nursing homes are almost 70%, if not higher, paid by Medicaid. And so we would have to make that same decision that you're asking the airports to do. I guess if you want to pass this legislation, what I would ask you to do is to create an amendment that makes the state responsible for any penalties or fines that we receive from the federal regulation. On the flip side, I would also ask you to create a pool of money that if you're going to require us not to follow federal regulations and we don't mask like we're supposed to, and nursing homes are very different than regular settings. Do we put the rights of one person above the other, the rights of the rest, or the protection of the rest? And so if we don't follow universal precautions and we don't protect the residents against the spread of COVID because we're following this regulation and someone dies because they're infected because we didn't follow those, then we can be sued for basically killing that patient and not protecting them. So I would ask you to amend this bill also to cover any expenses and any penalties that we may be imposed upon if we go to court and we're found liable because we didn't follow universal precautions. I also would just say that in section B, little 2I, I don't think the way this is drafted, that masks are specific to COVID-19. I think we need to probably tighten that up if we're only going to make this specific to COVID-19. And I would push back on those that say that this should be more encompassing. We've been using universal precautions, PPE, and immunizations and other things for years to protect life. And there are all kinds of situations within our healthcare facilities where masks are very, very important when it comes to communicable diseases, immunocompromised patients, and many other things. We talked with Representative McCann earlier. Our employees have to go through TB testing, which is a small injection of TB under the skin, and then we're tested to make sure we don't have TB before we start treating our patients. So this if we go broader than COVID-19, even has more tentacles and more problems for us. With that, I'd answer any questions.
Good timing.
I had it going in my head.
Yeah, thank you, Mr. Boley. Any questions of Mr. Boley? Representative McCann.
Thank you, Madam Chair. Just a quick question, sir. Is it federal law that you're worried about or federal guidelines?
Federal regulate,
Mr. Bully.
Madam Chairman, I'm sorry, and Representative McKenna, it's federal regulations. CMS imposes these on us, and they're the ones that control the purse strings. And I'll be honest, I'm frustrated with it. The conditions of participation were weaponized during the pandemic to force us to comply with mandates which we didn't completely agree with. But we're still under their control.
Any additional questions from the committee? Representative Clauston.
Thank you, Madam Chair. Thank you, Mr. Boley, for being here. Going through Wyoming law and statute, is there a specific term that refers to long-term care facilities or nursing homes? I mean, if we were going to do a carve-out for those facilities, how would we put that in this bill?
Mr. Bully.
Madam Chairman, Representative Clausen, I think it's captured under healthcare facilities, and I think in that particular section of statute, it lists all the different types of healthcare facilities. So I would imagine that if we were to amend it, we could make it specific to long-term care.
Vice Chair Ottman.
Madam Chairman, Mr. Bully, hi. What I'm wondering is that if we do a carve-out such as Representative was talking about and say about healthcare facilities, would a person that needed to go into one of these facilities, if they would not receive a vaccination, would that prevent them from having a place to go?
Mr. Bully.
Madam Chairman, Representative Ottman, no. The mandates and all the requirements have been lifted, and so we would actually ask, in long-term care, we're still required on a monthly basis, sometimes on a weekly basis, to report to the feds immunization status for our employees and our residents, but it wouldn't preclude them from being able to be admitted to long-term care.
Follow-up, Vice Chair Ottman.
Okay, then, and please excuse me for this, but what I'm hearing is contradictory. In one place, I'm hearing that the federal guidelines or regulatory CMS requires this, and then now I'm hearing, well, not really. So what is it? I mean, if people don't want it, and does it require that employees are vaccinated?
Mr. Bully.
Madam Chairman, Representative Ottman, so no, there are no requirements for vaccinations, although I do believe that under current law, a private organization could require their employees to be immunized, but not the residents. And what I'm talking about is if you have a resident that's in a nursing home already, and then COVID outbreaks, then we go into protocol that requires masking and other things, but has nothing to do with admission into the nursing homes.
Thank you, Mr. Bully. Any additional questions? I have one. Are there other, Mr. Bully, are there other states that have enacted similar legislation?
Madam Chairman, I believe there are some. I don't know off the top of my head how many, and it's not exactly the same in each of the different states. I am aware that some of them do have carve-outs for specific areas.
Thank you, Mr. Bully. Representative Gumas.
Thank you, Madam Chair. What would you prefer to see, carve-outs or the state to set aside funds to cover any fines?
Mr. Bully.
Madam Chairman, Representative Guggenmas, did I say it right?
Got it.
My preference would be to have healthcare carved out. Mainly for the reason that we don't know what's coming down the pike. Right now, avian bird flu is a big issue. It's not as deadly as others, but it's could potentially turn into something. We saw Ebola come into the States a few years ago, just before or even during the pandemic, and there were small outbreaks where it is a super deadly disease. I'd rather see the carve-outs, but if we move forward without the carve-outs, I'd like to see the state take the responsibility for what we may be penalized with.
Thank you. Follow-up, Representative Guggemos.
How much are we looking at to cover those fines? Do we have any kind of
Mr. Boley?
ballpark?
Madam Chairman, Representative Guggenmas, it all depends. A lot of it would depend on how many complaints there are. A lot of them would depend on how many surveys we have. I would tell you that under current regulations, this is, and I'm not going down a rabbit hole, I'm just trying to give an idea. Our nursing homes are already penalized with civil monetary penalties when they're found in noncompliance for certain things. The state right now is sitting on over $1 million from our nursing homes. In addition, there's about $500,000 of that, so 1.5 million that's set aside in the event that a nursing home fails and the state has to step in and fix it. With this being so political, I would imagine that we may see more and more complaints that are filed where the $5,000 penalty could be assessed. And with complaints brings the survey process, and the surveyors would come in and would find us in noncompliance. Director Jansen did a good job of explaining how that process works, but once we're out of compliance, we have to come up with a plan of correction, which basically says we're going to comply with federal law, but we're still precluded from doing that. So we are in a perpetual spin where we're never going to be able to comply with federal law and comply with this law.
Follow-up, Representative Guggenmas.
What would be better for the patient during this time, during COVID? I heard horror stories about what the patients actually had to endure. Was it actually healthier for them to be forced to comply with the regulations, or did it cause any kind of damage as a side effect? Is there anything, can you speak to that at all?
Mr. Boley?
Representative Chairman Rodriguez Williams and Representative Guggenmas. I think you'd hear both sides of the story. I think that the pandemic was a terrible thing. It was hell on earth. It was hell on earth for the patients. It was hell on earth for the providers. It was a terrible situation that I hope we never go through again. It's been the longest 3 or 4 years that you can imagine for the residents and for the healthcare providers. I think there were some negative things that happened because of the pandemic and because of isolation, especially in long-term care. We addressed visitation last year with a bill. On the flip side, without those precautions and things that were in place, I think the loss of life would have been higher. And the reality is we lost hundreds of thousands of lives through the pandemic. And I think we all were personally affected by losing those that we loved because of the pandemic. So I don't think there's any perfect solution to this, and that's the unfortunate part. But passing legislation that limits us going forward on what we might have is also problematic.
Thank you, Mr. Boley. I do have one more question for you. So we hear often that there's a healthcare shortage in the state of Wyoming. Just curious if the Hospital Association has polled its members or conducted any exit surveys when employees have left the hospitals due to vaccine mandates.
Madam Chairman, we have, and again, the results are mixed. We've had people leave because of vaccine mandates. Because of miscommunication and misunderstandings, there were hundreds and hundreds of exemptions that were allowed if the paperwork was filled out correctly. But we had others that left because they just got burned out because the pandemic was so trying on so many people and they were watching so many people pass. I can't say that there's a direct correlation on both sides of things, but it's been a very difficult period of time.
Thank you, Mr. Boley. Okay. Thank you for your testimony. Any additional registered lobbyists that'd like to come up and testify on House Bill 96? Okay, seeing none, I'm going to close public comment. Senator, did you want to come up and testify? Okay, Senator Hutchings. Welcome to Labor and Health, Senator Hutchings.
Chair, members of the committee, Senator Hutchings, Senate District 5. I just want to sit in support of this legislation, and I just want to say ditto to what former Representative Penn said. Thank you.
Any questions of Senator Hutchings from the committee? Okay, seeing none, thank you, Senator. All right, nobody's jumping out of their seats. So I will close public comment on House Bill 96. Committee, what is your pleasure? Is there a motion to, the bill's moved by Representative Gugemaz, second by Vice Chair Ottman. Discussion and amendments from the committee. Representative Klauston.
Thank you, Madam Chair. I guess I'll need the committee's help. I've got a few amendments I'd like to look at. Page 3, line 20. After the word covering, just add for COVID-19 purposes.
Second.
Amendment on page 3, line 20, after the word covering, for COVID-19 purposes. Mr. Caldwell, do you have that? Okay. All right. Discussion,
Madam Chair?
Representative Klauston.
Thank you, Madam Chair. So, you know what? I've previously voted for this bill in committee to get it on the floor. And I really have an issue with people being forced to take any vaccination for COVID-19, the way it was developed and that kind of thing. I think we're all looking back with better education now. But as far as this bill goes, you know, it addresses COVID-19. There are other infectious diseases that are caused by droplets that we know of now or may be coming in the future. So I just wanted to make this specific for this bill.
Representative McCann.
Mainly just thank you, Madam Chair. Mainly just a comment that most are good. There's some studies out there and some information out there that's pretty profound that most all of these vaccines are going to be going to the mRNA, which is specific to the COVID-19 virus. So I think we need to be a little bit careful before, you know, making it just COVID. There's an argument to make it for all at any rate. I'm not suggesting an amendment, but just a comment. Thank you.
Additional discussion regarding the amendment that's
Madam
been
Chairman.
moved. Representative Ginn.
Madam Chairman, so one of the benefits to making it, well, one, I think Ms. Ward literally said that she thought it was specific to COVID-19, and so this makes it clear. It just creates that clarification for everybody involved. But I think it also avoids requiring a exception or carve out for things like industrial purposes, right? So if you require a mask to make sure you're not inhaling metal dust, by only making it relevant to COVID-19 purposes, you don't need to create like an industrial carve out for that kind of purpose.
Thank you, Representative Yin. Additional comments about the amendment from the committee? Vice Chair Ottman.
Yes, just a question to the bringer. Oh, Madam Chair, excuse me. Would safety regulations cover that without putting that in there? I mean, OSHA has requirements for industrial and on-the-job. So do we really need this?
Representative Klauston.
Thank you, Madam Chair. Thank you, Representative Ottman. I think we do need this because, I mean, you're talking about OSHA and their requirements. This is specific to COVID-19. So I guess to me, we're not doing apples to apples. I mean, I think we're trying to address one specific problem here. And I just think we need to be clear on it.
Thank you. Additional discussion on the amendment? Representative Yin.
Madam Chairman, just to respond to that OSHA comment as well, I think that's just another place where the bill is in conflict. And so with the amendment, it actually puts it out of conflict with OSHA, right? So if there are OSHA regulations that require you to wear a mask and require a business to put a sign up that requires a mask, without the amendment, they would still be in conflict. So a worker could say, you know, I'm aggrieved by having to wear a mask to the business, sue for $5,000, and then the business goes and says, I have to hold this because I have to follow OSHA regulations. So it's just one more thing to avoid that federal conflict.
Thank you, Representative Yin. Any other discussion from the committee on the amendment? Okay, seeing none. All those in favor of Representative Klauston's amendment, please state aye. All opposed?
No.
That amendment has passed. Moving on, additional amendments from the committee. Representative Klauston.
Thank you, Madam Chair. Thank you, committee. On page 4, line 7, the fine is $1,000 or $5,000. I'd like to reduce that fine to $1,000, especially in the beginning here. We're not quite sure how this is going to be applied. So $1,000 is still significant. And I think at this point, maybe as we work through the bill and see how this is going to affect people, persons in Wyoming, maybe $1,000 is a little bit more appropriate.
Thank you, Representative Klauston. Mr. Caldwell, do you have that? Thank you. Discussion, or, sorry, there's been moved by Representative Klauston and second by Representative Yen. Discussion on the amendment. Seeing none, we will, Representative McCann.
Other than, I just want to mention that I don't agree with this. I think we should keep it where it is. Thank you.
Additional discussion on the amendment? Okay, seeing none, all those in favor of Representative Klauston's amendment on page 4, lines 6 and 7 to reduce the section from $5,000 to $1,000, please state aye. All those opposed?
No.
No. Okay, that amendment has failed. Committee, any additional amendments or discussion? Okay, Representative Klauston.
Thank you, Madam Chair, and thank you, committee, for indulging me working on this bill. Page 4, line 8, I would like to just add the sentence. It would read, "This act shall not apply to the specific wearing of masks in Wyoming long-term care facilities and airports." So this would be a carve-out for those 2 areas that we've had some concerns about.
Okay, the amendment, Representative Klauston's amendment has been moved and seconded by Representative Yen. Discussion from the committee on the suggested amendment to carve out long-term care facilities and airports. Okay, I do have a question, Representative Klauston. We, not to get into the weeds, but do you think that when we talk about airports, and obviously different types of airports, is your amendment more focused on federally funded airports? If you could just elaborate a little bit more on that.
Thank you, Madam Chair, for the question. Yeah, my intent here is just to, any place that the federal mandates would put these 2 types of facilities in conflict. So, maybe there's parts of the airports, or there's certain airports that aren't federally supported. I would be all for leaving those out. I'm just worried about the financial situation and health, and then, of course, the long-term care residents. So keeping those facilities open. So I'm open to any suggestions on language that would say federally mandated areas.
Additional discussion. Okay, so would you, Representative Klauston, consider it a friendly amendment to change the verbiage on that to federally mandated areas of airports, or do you have any suggested language for that?
Thank you, Madam Chair. I think that's absolutely correct. So trying to see if I could come up with a version here, but yeah, so wearing of masks in long-term care facilities and those areas in airports that are federally mandated.
Representative Gugemaz.
I'd just like to say I'm against this amendment, and for the reason of, I don't believe we need to be facilitating federal government overreach. I believe as a state, it would be our responsibility and duty to stand up against federal overreach.
Thank you, Representative Gugemaz. Additional comments from the committee on the amendment? See none. Okay. Mr. Caldwell.
Madam Chairman, Representative Klausman, could you just repeat the language for me one more time?
Certainly. So this act shall not apply to wearing of masks in Wyoming long-term care facilities and in airports where federally mandated.
Thank you, Madam Chairman, Representative Klausman.
All right. Okay, seeing no additional discussion on the Representative Klauston's amendment. All those in favor of the amendment, please state aye.
Aye.
All opposed? Okay, that amendment has failed. And Representative Klauston, you have another amendment idea.
Thank you, Madam Chair, and again, thank you, committee. So if we are going to have this law that does not comply with federal policy, I'd like to add an amendment, page 4, line 8. It would state, if any individual is fined for complying with Wyoming state law in contradiction to federal policy regarding the provisions of HB 0096, the state of Wyoming shall reimburse the individual for the full cost of the fine. Reimbursement funds shall be drawn from the Legislative Stabilization Reserve account. And actually, Mr. Caldwell, I guess I would change individual in both spots to person. So my thought being here, if we know what we're doing, we're going into this, and we're putting some facilities at some financial risk. So if those facilities are supporting what this committee passing this law, that we would give them some financial support for complying with us against the federal guidelines.
Okay, the amendment has been moved, seconded by Representative Yen. Discussion on the amendment from the committee. Representative McCann.
Again, just a comment, I think, it's time to stand up to the federal government, make them listen to the states for a change. That's just my comment on that. Thank you.
Thank you. Representative Gugemaz on the amendment.
Thank you, Madam Chair. Would this be before or after we did try to stand up to the federal government as far as paying with state funds that fine? Would we litigate before that point, or would it be after? Is there any way of knowing that? I don't know how that would work.
Representative Klauston.
Thank you, Madam Chair. Thank you for the question. My thought is this is probably going to cause some litigation, right? Like a facility is going to get fined. It's going to go to court. And maybe we need to help cover the litigation costs. I mean, these facilities are going to have to choose. Do they follow the federal guideline and we fine them $5,000? Or do they not follow federal guideline, and whatever those fines are, we're going to have to pay for? So, I mean, I guess I'd be open to a friendly amendment adding to this that the state's going to end up paying for those litigation fines and maybe that's included in this language, but we're going to see a court case, which is fine. I mean, we're standing up to the federal government here, but I think if we're going to do that, these facilities are going to comply with Wyoming law, that as we put this law on them, we probably need to support those facilities. Otherwise, we're going to lose facilities. We already have limited care for our elderly. If we lose any more facilities, our elderly are going to be leaving the state for care.
Additional comments from the committee on the amendment? Vice Chair Ottman.
Thank you, Madam Chair. I just, listening to all of this, and my last comment, and then where it went down a road that wasn't intentional, but just to say, historically, health departments, local health departments deemed when there was a outbreak of something. And those departments said what would go on in those communities and with that population. To have a federal and to follow federal guidelines without any sort of pushback, or for lack of another word, is only to encourage the continuation of those types of actions. This was proven that this was a determined attack on our population, and it shouldn't be. Disease is usually local in its scope, not national. And to have to submit to federal guidelines about things again and again, and to encourage litigation, especially when we know that that can cost a lot and put those facilities out of business because they won't be able to stand up against the federal government with a suit like that. I think that's why I'm against it, not because I don't believe in protecting people or supporting nursing homes. But what we've seen, at least in my county, is that this put them out for lots of reasons. And just to encourage and encourage and encourage federal overreach into our local communities and our states, because there's something with a national healthcare decision, it just goes against what I believe. And so that's kind of why.
Thank
So
you,
I'll be a no on that. Thank you.
Thank you, Representative Ottman. Representative Gugemas. Representative Klauston.
Thank you, Madam Chair, and thank you, Representative Ottman. Like, I completely agree with you. I think each local community, right, should get to make their own decision. But what this bill is doing is telling those facilities they have to choose between following our state law that we're suggesting, so there's more local control, or they have to follow the federal guidelines. And if they choose to follow our local control, which is what we're putting in here, they may get fined by the feds, by CMS. So all I'm asking here is, because we're telling them to choose Wyoming guidelines over the federal guidelines, that we're gonna help financially support them, because they're already in financial crisis. And if we're gonna make them receive fines for following the Wyoming law over the federal law, I would like to support those facilities.
Thank you, Representative Klauston. Representative Gugemas.
Thank you, Madam Chair. Instead of going through a possible perpetual paying of fines, the federal government is kind of encourageable, you know, just keeps it up. Could we task our AG with the litigation of these issues?
Representative Klauston.
I guess that might be more of a, I mean, I'm definitely open to that. I just think it's more of a question to the AG, but the facilities are still gonna get fined. So, I mean, I think we could definitely ask the AG's office if they could defend our law here, and that's probably really what would happen. I think you are correct. But they're still gonna get their fines from CMS. So I guess my amendment is just that we, state of Wyoming, pay for those fines for those facilities choosing to follow Wyoming law over the federal guidelines.
Further discussion on the amendment? Okay, seeing none, all those in favor of Representative Klauston's amendment, please state aye.
Aye.
All opposed?
No.
That amendment. Division has been called. Mr. Caldwell, if you would take a roll on the amendment moved by Representative Klauston. Thank you.
Representative Klauston,
Aye.
Representative Gugemas,
No.
Representative Heft, Representative McCann, Representative Ottman,
No.
Representative Stivar,
Excused.
Representative Wasserberger, Representative Yen.
Aye.
Chairman Rodriguez Williams.
No.
Madam Chairman, that is 3 ayes my apologies, 2 ayes and 6 noes.
Thank you, Mr. Caldwell. Any further amendments from the Committee on House Bill 96? Representative Yin,
Madam Chairman, no amendment, but just discussion, if that's okay, if we move on.
please. If there's no further amendments, we can do that.
So, Madam Chairman, federal funds is one thing, I think if we are going to defund our hospitals and our long-term care facilities, we should, and we're asking them to stand up to the federal government, we should also back them up in that case. So I regret that we didn't accept that last amendment. But I want to say that my primary reason for voting no on this bill is one that I think Representative Penn talked about, which is talking about liberty and freedom. So almost any time that we have the word prohibit in a bill title, we're talking about curtailing somebody's freedom. I think the bill chooses one person's freedom over another person's freedom, and that is the one that takes those grants. So whether it is a small business that takes a small business administration loan, or a huge business like a healthcare facility or anything else, we are restricting their right to choose who can walk in their door. I think that there are great public reasons to make sure that every member of the public can access a healthcare facility, but things like a small business, we're telling them that they are not allowed to choose who their customers are. And there are certain reasons to do that and certain reasons to not do it. But if we're talking about curtailing somebody's liberties, we should be also talking about whose liberties are being curtailed and in favor of whom's. And so with that, I am going to vote no on the bill. Thank you, Madam Chairman.
Thank you, Representative Yin. Okay, committee, Representative McCann.
Thank you, Madam Chair. This is one of those darned if you do, darned if you don't type things. I'd like to see the bill go forward mainly to get more consensus within the body. Thank you.
Thank you, Representative McCann. Okay. No further comment from the committee. Mr. Caldwell, if you'd call the roll on House Bill 96.
This is a roll call vote for House Bill 96 as amended. Representative Klauston,
Aye.
Representative Guggenmoss,
Aye.
Representative Heft, Representative McCann, Representative Ottman,
Aye.
Representative Steiger,
Excuse.
Representative Wasserberger, Representative Yen,
No.
Chairman Rodriguez-Williams.
Aye.
And Madam Chairman, that is 7 aye, 1 no, and 1 excused.
Thank you, Mr. Caldwell. And Representative McCann, just be prepared to present your bill on the floor. We will move on to House Bill 135. This bill is titled, how do you pronounce that? Autologous or direct blood donations. Again, House Bill 135. This bill is sponsored by Representative Guggenmoss. Welcome, Representative Guggenmoss. If you would, please go ahead and walk us through your bill.
Thank you, Madam Chair and committee members. House Bill 135, the autologous or direct blood donation. This is really a medical freedom bill. It's authorizing the use of autologous or direct blood donations as specified, authorizing reasonable fees for blood donations and providing definitions, and some rulemaking effective dates. Page 2 goes through the definitions of what autologous blood donation and direct blood donation mean. So section B is specifying hospitals or other healthcare facility licensed under this title shall allow a person to whom the medical procedure is to be performed at the facility to donate a healthcare provider ordered autologous or direct blood donation before the medical procedure if the facility performs blood donations. And the blood bank that facilitates autologous or direct blood donation shall comply with the healthcare provider's orders prescribing the blood donation for a person. This was not my line of country. This is not in my wheelhouse when I took on this bill. But the more I've learned about it and the more I've realized just how imperative it is, I did not realize all the intricacies of how important blood is and what can be contained in the blood. So for those that are having medical procedures planned or even in emergency use, this would give them the option of knowing whose blood they will be receiving and just kind of gives peace of mind. So with that, I will take any questions.
Thank you, Representative Gugemas. Does the committee have any questions about the content of this bill? Representative Wasserberger.
Thank you, Madam Chair. Just out of curiosity, for the place that people would be storing this, would that be applying to the hospitals or just the blood banks would have the excess blood for people that are doing that for personal use, or?
Representative Gugemas?
Madam Chair, if I
You'd like
could-
to defer to a witness later?
Yes, I
or-
would, if you could.
Yep. Oh, okay, you have a guest.
Yes, that's Sarah Penn.
Yep.
If she could.
Former Representative Penn, welcome to Labor Health Committee. If either one of you would like to answer Representative Wasserberger's question, please.
Thank you, Madam Chairman. Representative Wasserberger. So I believe the question was, where would the blood be stored? So generally, especially in Wyoming currently, the blood would be stored where it is donated. There are various blood banks that are getting started out throughout the country that offer networking and things like that. So a individual could, you can pre-donate, you can say, I have a surgery coming up, you can donate for yourself. So that's autologous. The autologous blood donation is when you donate your own blood for your own self. Direct blood donation is when you donate blood that can be used by someone else. And so those things would still be happening at the facility where the blood is drawn and stored that way as well.
Thank you. Committee, any additional questions of the bill sponsor or his guest? Representative Klauston.
Thank you, Madam Chair, and thank you both for being here. It's nice to see you again. Miss you. Any idea how long the blood can be stored safely and still used? And it's just outside my wheelhouse, so just a question.
Former Representative Penn.
Thank you, Madam Chairman. Representative Klauston, it depends on what kind of blood we're talking about as to how long it can be stored. I believe that whole red blood is about 60 days or something like that. Thank you.
Follow-up, Representative Klauston.
Thank you, Madam Chair, and then thank you for that. Just curious on cost. In the bill here, it says reasonable fees. Do we have any idea what those kind of fees would look like, what the programs look like?
Representative Gugemas or former Representative Penn.
Thank you, Madam Chairman. Representative Klauston, so currently in Wyoming, we don't use Red Cross, we use Vitalant. And so if you were to go to the Vitalant website, it does state on there, so Vitalant does offer on their website direct blood donation draws as well as autologous draws. It is stated on there that they do charge a fee for that. It doesn't say what the fees are. I'm not certain what the fees are, but there is a fee charged.
Additional questions from the committee? Yeah, Representative McCann.
Thank you, Madam Chair. I know in the early 2000s that a lot of the hospitals would allow us to do that. Is there a reason they got away from it? It fell off the radar with me, so.
Representative Gugemas or former Representative Penn.
Thank you, Chairman, Representative McCann. I think that largely a lot of facilities still technically offer it. I think that I'm not certain why it's gotten to be less practice if people just aren't aware of that opportunity. I have had outreach from not just constituents, but people across the state and really in other states saying, congratulations on going this direction, because what they encounter is a resistance by healthcare providers to fill out the paperwork. And so a lot of times I think that might be where things get held up, is trying to find a provider willing to write the order. So this is something that does require a doctor's order. You can't just go to Vitalant and say, I want to have blood drawn so I can use it in the future. You do have to have that go with an order.
Thank you. Representative Wasserberger.
Okay, thank you, Representative. Just another quick question for you. I'm just curious, so the blood can be stored for about 60 days. Would this, for somebody that's wanting to do that for a surgery coming up, do you think that would be a health concern for them to be losing some of their blood before that surgery? I can understand why people would want to use their own blood for later, but do you think there'd be any health issues with them on that end?
Representative Gugelmas, or former Representative Penn.
Thank you, Madam Chairman. Representative Wasserberger. So in the bill, it does state donation as long as the person is found healthy enough, right? And so this bill, it's notable to be aware that this only applies to non-emergent situations. And so if you were in a situation where you immediately needed blood, therefore probably not healthy enough to donate your own, you're requiring it. And so yes, it's imperative that someone is healthy enough to donate. And so if you went to Vitalant for one of these blood donations, you would still go through the same rigorous process, the questioning period. I mean, there's pages of questions that you fill out when you go to donate blood. And so a lot of any health issues would be weeded out during that process.
Further questions from the committee? Representative Clauston.
Thank you, Madam Chair. Just a comment to answer the question. Several of my patients will do this. So they usually recommend a minimum of 3 days, but usually it's a week beforehand, because the body can reproduce enough blood that it's safe. Just give you an idea.
Thank you.
Thank you.
Additional questions? Okay, seeing none, thank you to the bill sponsor and guest. Stick around in case we have questions for you. All right. Raise your hand if you plan on testifying for this bill. Okay, we have got one in the audience, and it looks like we have about 6 that were hoping to testify online. So I will limit public comment to 2 minutes, just for the sake of time. So if there are any government agencies that would like to come forward and testify on House Bill 135, please come forward. Okay, seeing none, we'll move on. Public comment in the audience. Former Representative Penn, welcome. Good morning. Please state your name and who you're with and whether or not you oppose or support the bill.
Thank you, Representative or Chairman Rodriguez-William. I'm Sarah Penn from Fort Washakie. I am representing myself. So this bill stems from concerns that that kind of piggyback on the previous bill, COVID and COVID vaccines and what is in the blood. We've seen multiple innumerable adverse effects come from those vaccines. And the question is, what about the blood, right? And so the issue mainly seems to be the spike proteins. We don't know how long spike proteins last in the body. Studies have been done that look as long as 6 months, and they are present in about 50% of blood samples at 6 months. To my knowledge at this point, no one has looked longer than 6 months. They're found in all organs. If you look at the evidence, what does the evidence say? There's been 3,400 peer-reviewed papers that show myocarditis. Folkson et al. Looked at the Global Vaccine Data Network and examined 99 million people. And they found that there's a significantly increased risk of myocarditis, pericarditis, Guillain-Barré syndrome, cerebral venous sinus thrombosis in these genetic vaccines. The spike protein is physically found in some of these clots that embalmers are finding. And if you've seen if you watched, you know that there are some pretty strange looking clots that are coming out of people who have had these shots. So the question here is, can it be transmitted? We don't know. We see situations across the state. Baby Alexander in Washington State, he'd had a blood transfusion and subsequently ended up with an enormous clot. Not just a clot, an enormous clot from his heart to his knee. I say, we're not going to find what we're not looking for, right? And at this point, people really aren't looking. If you look at blood donation history in the 80s, they weren't looking for HIV. It took them 5 years to recognize that HIV can be transmitted through blood transfusions. In May of this year, a doctor looked at a Japanese meta-analysis. So a meta-analysis looks at various studies and kind of synthesizes that information. And they warned of risks using mRNA vax blood. They said that the spike proteins might be prion containing. So prions are folded proteins that increase risk of neurodegenerative diseases like Creutzfeldt-Jakob. These things are diseases that linger long, you may not know, and then all of a sudden it's very quick.
Former Representative Penn, you were out of time.
All right, thank you.
Yeah.
I appreciate your support on this bill.
Thank you for being here with us today. Any questions from the committee for former Representative Penn? Representative Yin,
Madam
please come
Chairman.
back up for questions. Thank you.
Appreciate it. And thank you, Representative Penn, for answering, for being here. So and maybe this is a question for Representative Guggenmoss as well. Are there constituencies that have tried to get a self-directed donation that have been turned away? So when we want to, force a new regulation, are we solving a problem that's currently happening?
Former Representative Penn.
Thank you, Representative Chairman Rodriguez-Williams and Representative Yin. So I have had people reach out to me and say, as I kind of mentioned before, they are encountering some difficulty with paperwork and such. And I don't know specifically if that's because of the resistance of healthcare facilities versus healthcare providers. I think it's a little bit of a combo of both. I think that doctors see it as a hassle. I don't like it when people bring me paperwork that are this, the paperwork is 2 pages. It's one page front and back. But it does hold things up. I think sometimes offices, when they're coordinating with hospitals trying to get a surgery date scheduled, and maybe Representative McCann can speak to that even more than I can. But yes, there are people that are looking for this. Again, I mentioned previously the networks that are out there. One's called Safe Blood, where you can, if you all want to pay a membership, you can start donating, or you can just have a membership in case you need unvaccinated blood. And so this would just open the door to allow those types of situations to come in so that people have the opportunity to make this choice for themselves.
Thank you. Follow-up or additional questions of former Representative Penn? Representative McCann.
Just to comment on that, we did do this quite frequent, especially with hip surgeries in the early 2000s, hip replacements, because we can't put a tourniquet on it, so they have a tendency to lose a bit more blood. I don't know where it fell apart in the fact that somewhere it was a pain in the butt, and it just, I don't know where that happened, but we definitely got away from it. But it was pretty popular in the early 2000s. Maybe we do need to give some people some guidance to do it. Thanks.
Thank you. Okay. Thank you, former Representative Penn. Additional public comment on House Bill 135 from the audience? Seeing none, we'll move on to Zoom. And we've got a few there. Okay. Welcome, Mr. Levy, to House Labor and Health. If you'd please state your name, who you're representing, whether or not you support or oppose the bill, and you have 2 minutes to testify.
Thank you very much. My name is Gil Levy. I'm representing Pure Blood Registry. I support the bill wholeheartedly. I'm a patriot, an entrepreneur, and most importantly, a father to my 3-year-old daughter. In 2022, driven by deep concern and my commitment to her future, I founded Pure Blood Registry. It's a platform to ensure that families like mine can access trusted blood donations from close friends, family, and community during medical procedures. And today I'm speaking on behalf of the thousands in our medical freedom community, including our Wyoming residents and members, and on behalf of the tens of millions of transfusions procured every year. And this initiative, it really stems from the lessons learned from history. If we remember in the 80s and 90s, the US, the Australian, and the UK blood supplies were tragically contaminated with Hep C and HIV. In the US, 63%, nearly 10,000 people, were infected with HIV through contaminated blood products. And during the HIV/AIDS epidemic, public health agencies failed us, and they failed to screen the blood supply adequately. Bureaucratic inefficiencies and prioritization of corporate relationships over public safety led to the spread of infections. And these systemic failures have had a lasting impact, with patients and families feeling left behind by policies that prioritize profits over safety. Now, due to time, I'm not going to go into the $11.8 billion or pounds set aside by the UK to compensate victims after a 2024 inquiry that revealed that the disaster was avoidable and that patients were knowingly exposed to unacceptable risks. We're seeing this happen in Australia, and I'm pretty sure that's going to happen here in the US as well. But let us not ensure that such a tragedy is ever repeated in Wyoming or in this country. We must learn from history, and we now have the obligation to put a stop to this urgent and ongoing catastrophe in present day. And sadly, I continue to hear heartbreaking stories of preventable harm, including death, merely hours or days after our loved ones or members have a blood transfusion due to tainted blood from the general blood supply. And
Mr. Levy, you are out of time. I'd like to thank you for joining us this morning. Thank you for your testimony.
Thank you.
Okay. Welcome, Ms. James, to House Labor and Health. Please state your name and who you represent and whether or not you support or oppose House Bill 135, and you'll have 2 minutes for testimony.
Good morning. Thank you, Madam Chair and committee members. I am speaking on behalf of myself and also everybody who values their medical freedom, and also the members of our not-for-profit cooperative community, which is Blessed by His Blood. We have members in Wyoming and nationwide. I want to thank you for allowing me to speak on behalf of House Bill 135, which if passed will protect the medical right of your constituents to continue to choose the source of their blood donation in the event of an urgent medical need or a scheduled medical intervention. The right to designated or autologous blood donation is a nonpartisan medical freedom every person deserves the right to have without barriers in times of medical need. Autologous and directed donor blood allows for an increased measure of quality and safety, and its availability gives the patient greater personal authority over what is being introduced into his or her body. A few key points. The longer that blood has been on the shelf, the lower the quality of the blood. I can go into greater detail later if needed. Additionally, the donor blood is only tested as per the FDA website, or I'm sorry, the American Red Cross website. It's only tested for 12 key diseases. Other bacteria, viruses, and parasites, as well as any other contaminants, are still transmittable through blood products. An example for that would be Epstein-Barr virus. In health-compromised individuals, this can be an added and unnecessary bioburden when in a state of healing. While autologous and directed donor blood donations have been available and utilized for decades in the healthcare system, it is becoming increasingly difficult to ensure that a blood recipient's desire to receive known blood donor status blood is actually achieved. Most frequently, and we are seeing this here in our organization, this basic patient right is being refused at either point of service, i.e. at a hospital, clinic, blood donation center, despite the decades-old designated donor practice in our country. To be clear, when a patient and their doctor request directed donor blood, they are not requesting something novel. HB 135 will simply protect a freedom that has existed for decades, but is quietly being erased by the blood industry. Please
Ms.
consider.
You are out of time.
Thank you.
Yeah, thank you for joining us this morning. Thank you for your testimony.
Thank you.
Madam Chairman, there are other people in the Zoom lobby, but they don't have their hands raised.
Okay, if you are in the Zoom lobby and want to testify on House Bill 135, please raise your hand. Okay.
Can you hear me?
Yes, Ms. Scribner, thank you for joining us this morning. Please state your name, who you represent, whether you're for or against House Bill 135, and you have 2 minutes to testify. Thank you.
Sure. Thank you, Madam Chair and committee. I represent myself and my family. I'm in Lander, Wyoming, and I am for this bill. I just wanted to echo really quickly, actually, everything that everybody has said for this bill, but I want to add one specific thing that may not have gotten in there. There is evidence and testimony that there is DNA contamination in the COVID-19 vaccines, which includes a known cancer mutation, which is SV40. So if I have, or my family has, future surgeries, I would like to be able to donate, either for my husband, my child, or donate for ourselves going forward. We also have a unique situation. Our daughter gets IVIG infusions as well. I think there actually is potential down the road, if this does pass, that myself or my husband can actually donate blood for that. I've spent numerous hours actually contacting the companies that manufacture this blood product, and I cannot get an answer whether or not the spike protein actually transfers into that product or the SV40 mutation. So this would be a huge benefit to our family, and I appreciate your time. I'll take any questions.
Thank you, Ms. Schreiber. And committee, I apologize. I forgot to ask if anybody had any questions of the last two folks that testified. I apologize for that. Representative Clouston, you have a question.
Yes. Thank you, Madam Chair, and thank you for your testimony. Right now you can go ahead and do this. You can donate for yourself or for your family members. Have you specifically tried to do this in the past and were denied or had problems doing it?
Ms. Schreiber.
Sure. Thank you, Madam Chairman and Representative. Personally, I have not. I, as well as Ms. Penn said, that I am another constituent that has fought hard for this, and I have heard of other people. I have actually known someone also to fly from the state of Texas all the way to the state of Hawaii in desperate need of blood because they wanted it to be safe in that moment. That was years ago. I have not tried to donate for our daughter's infusions. That's a pretty lengthy process. That particular product takes anywhere from 1 to 1.5 years to process, but it has been a huge concern of mine. And with this bill that has been brought forward, I'm excited to look into this. And I think there actually is a possibility to be able to do this.
Any additional questions from the committee for Ms. Schreiber? No? Okay. Ms. Schreiber, thank you for your testimony this morning.
Thank you.
Good morning, sir. Welcome to House Labor and Health. If you would please state your name and who you represent, whether or not you're for or against the bill, and you'll have 2 minutes to testify. Please.
Thank you, Madam Chair and committee members. My name is Dr. Ralph Fasalo, Chief Medical and Scientific Officer with Vitalant, your blood collector and supplier along with the American Red Cross. We have donation centers in Cheyenne and Casper and operate blood drives throughout the state with the generous support of your community. I'm here today to oppose House Bill 135, which seeks to unnecessarily insert the government into healthcare decisions, as hospitals and blood centers already effectively facilitate all medically necessary autologous and directed blood donations. First, House Bill 135 offers no public benefit that could negatively impact patient care. Currently, when a doctor initiates an autologous or directed donation for a patient, blood center physicians who are specially trained in transfusion medicine are consulted to ensure it's medically necessary and won't pose unnecessary or unrecognized harm for patients. House Bill 135 seeks to remove that blood center physician involvement, which will most certainly lead to adverse patient outcomes. Please also consider that the community blood supply meets the vast majority of patients' blood needs today. Less than 0.04% of blood transfusions are autologous or directed every year. There's simply no need for this bill. Second, if autologous and directed donations were to unnecessarily increase in volume, it would divert our limited resources from maintaining the community blood supply for all patients. The bill also seems to suggest that nonprofit centers may not be able to fully recover their costs from collecting and processing the donations, which could further impact blood centers' ability to serve their communities. And third, directed donations are inherently less safe than the community blood supply. Directed donations not medically evaluated and necessary pose needless health risks to patients, including unusual transfusion reactions and complications with future pregnancies, and may impact transplant eligibility for the patient if they ever need one. Further, directed donors, particularly family and friends, may feel pressure to donate and be less transparent about their health history, which can result in potential health risks for the donor and increased infectious disease risk for the recipient. In conclusion, I urge you to oppose House Bill 135 as it's a government solution looking for a problem that does not exist, provides no public health benefit, could impact the reliability of the community blood supply, and may harm patients. Please
Thank
let
you,
me know if you have
Mr.
questions, and thank you for the opportunity to share this perspective.
Yeah, does the committee have any questions of Mr. Vassallo? Representative Yin.
Madam Chairman, thank you. Mr. Vassallo, so can you walk us through what the process is like if you are a patient and you want to either do autologous or directed blood donations? So we heard some testimony saying that it is maybe more onerous now than it used to be. Is there some place where we can streamline that process a little bit?
Mr. Vassallo.
Yes, as you've heard from former Representative Penn, a physician's order is needed to ensure medical necessity for the autologous or directed donation. Once the individual has that prescription, they come to the blood center or to a hospital. Some hospitals do collect these as well. And the physician there who is in charge of maintaining the health of that donor and ensuring that that's the correct donor for the recipient will evaluate as well. He or she is often an expert and has more than the 3 hours of training that most other physicians do not in transfusion medicine. So with that decision together, the individual is scheduled for a blood donation, and that blood is shepherded through the process, a single unit that's much more difficult to track than a unit that could be taken off the shelf immediately when and where it's needed.
Thank you. Representative Yin.
Madam Chairman, so just to make that clear, the physician has to go to the blood bank with the patient or the donor? Or is that not the case? I'm trying to clarify what I heard.
Mr. Vassallo?
No, Madam Chair and Representative Yin, the individual who wishes to donate autologous or directed blood gets a prescription from their physician, which is transmitted to the place where it'll be drawn, either the hospital or a blood center. No physician needs to come with the donor.
Representative Clouston?
Thank you, Madam Chair, and thank you for your testimony. To be quite honest, you're the first person I've had oppose this bill, and I understand this is your wheelhouse and you're an expert here, but is there anything in this bill that you're particularly worried about? Is there something we could do to this bill that would make it better from your point of view?
Mr. Vassallo?
Yes, Madam Chair and Representative Clouston, I appreciate that question. I think that really what could be done would be to ensure that the blood center physician consultation is not overstepped, that expert can help to ensure that this donation, be it autologous or directed, is medically necessary and poses no additional risks that are unrecognized by the prescribing physician. And we'd also ask to remove language that might limit the ability of a hospital or blood center to recover all their costs. We're nonprofits and do serve the community and require the payment for these that would allow us to continue serving our communities.
Additional question, Representative Clouston?
Thank you, Madam Chair, and thank you for that response. In the bill, it says the blood bank may charge not more than their regular fee to facilitate this donated blood. Can you give us any idea of what those fees are? And then it also does give you the ability to charge a fee to store the blood. So just wondering how you see that part of the bill not covering your costs.
Thank you. And Representative Clouston's referring to page 3, lines 6 and 7 of the bill. Mr. Veloso?
Yes, thank you, Madam Chair and Representative Clouston. Currently, our charges with 2023, there were less than 4,000 autologous and directed donations across the U.S., which allows a costing of around $500. But if that were to increase significantly, that would be above the, if you will, regular cost. When physician time is taken to chase down other physicians, work with donors and patients, it can rise significantly on a per hour fee for physician consultation, which is not currently counted.
Additional questions of Vitalant? Mr. Representative Gugemas?
Thank you, Madam Chair. You mentioned that direct blood donations are more risky than regular donations. Could you clarify that?
Absolutely. Thank you, Madam Chair and Representative Gugemas. We ask questions, and these questions are about behaviors that increase the risk for infectious diseases. If someone has manifested a behavior within the last month or so, sometimes our testing is not able to detect them within several days of infection. And therefore, an individual who is motivated to ensure that they don't walk out without having donated blood will not necessarily disclose those risks, and it poses an increased risk that has been shown in many studies to exist for donated directed blood.
Thank you. Okay. I don't see any additional questions for you. Thank you for joining us this morning and for your testimony. We appreciate it.
Hello, good morning.
Good morning. Welcome. Please state your name and who you represent, whether or not you oppose or support the bill, and you'll have 2 minutes.
Sure. My name is Krista O'Day, and I am in support of this bill and represent Remnant Healthcare, a team of nurses who provide advocacy services for our members seeking direct blood donations from family members, friends, or donors of their choice. What is of most concern is protecting a patient's choice for bodily autonomy, informed consent, knowing their options regarding receiving blood, including religious rights, and freedom of choice about what can and cannot enter one's body. What I have seen as a patient advocate is that some blood banks, such as the American Red Cross, are making the direct blood donation process lengthy and time-consuming for physicians, such as making, for example, doctors must personally call each donor on their patient's behalf. This makes them less likely to sign off on such directed donations for their patients. Additionally, there are high charges for directed donors, such as a $500 per donor fee, which can be costly for the patient receiving this blood. Directed blood donation processes can be further streamlined and timely as well, and should be accessible choice for all patients. A physician's order is needed for all blood donations, not just directed donations. And some common issues between family members, such as husband and wife of childbearing age, those who are on blood thinner products, or those who have recently traveled, are also questions that are asked of those anonymous donors as well as directed donors. And also the testing is the exact same for anonymous blood donations as it is for direct blood donations. So there is no risk, additional risk for directed donations as opposed to anonymous blood donations. And that's all I have to say. Thank you so much for your time.
Thank you, Ms. O'Day. Any questions from the committee? Ms. O'Day? Okay, I don't see any here. Thank you for joining us and for your testimony.
Thank you.
All right, committee, oh, it's a little late here. Yeah, we lost track of time here. The big clock, not the timer. Committee, we are going to have to carry over this bill to our next meeting, which is House Bill 135. And at that time, during our next meeting, we will begin with additional public comment from registered lobbyists, and then we'll work the bill if it's the committee's desire to do so. So I apologize that we ran over time. But thank you, everybody, for joining us today, and our meeting's adjourned. I was hiding.
It's over there.